Okay, so today we'll be discussing about the middle ear cavity. Now in pharynx, if you remember, three subdivisions are there of the pharynx: nasopharynx, oropharynx and laryngopharynx. Okay, three subdivisions are there of the pharynx. Now, do you remember the features of each and every subdivision? Why I am asking? Because it is related to the middle ear cavity. That's why I am asking. In nasopharynx, a opening is there. In the nasopharynx, a opening is there. If you remember, that is opening of the auditory tube or pharyngotympanic tube. Have you studied about the pharyngotympanic tube? Yes. Can anyone tell me the length of the pharyngotympanic tube? What is the length of the pharyngotympanic tube? Hmm? It is approximately 3.6 centimeter or 36 millimeter. Okay, pharyngotympanic tube. How many parts are there of the pharyngotympanic tube? Two parts. First cartilaginous part and then the bony part. Okay. Now this bony part and cartilaginous part, they are making the pharyngotympanic tube, and the pharyngotympanic tube is connecting the middle ear cavity with the nasopharynx. Okay. So the pharyngotympanic tube is very important. Please study the pharyngotympanic tube. Now, in middle ear cavity, what exactly you have to study? See, middle ear cavity is a very important topic. Okay, especially applied questions are asked during the time of final exam from middle ear cavity. Okay, so at least 2 classes will be required to complete the middle ear cavity. So today we will be discussing the gross anatomy of the middle ear cavity. Now, what exactly you have to know in the middle ear cavity? There are some points which I will mark. Okay, everyone should note the points. Take out your pen, pencil, notebook and mark the points. Now, how to study the middle ear cavity? First of all, you have to know the location of the middle ear cavity. Okay, where the middle ear cavity is situated. Next, the shape and dimension. Okay. Next, communication. Okay, so this cavity is communicating with which part? The communication part of the middle ear cavity. Okay, boundaries of the middle ear cavity. Now, these boundaries are very important. Okay, now in boundary, you have to know two things. First of all, how it is formed. And features. Okay, in boundaries, these are the two important points which you have to know. Okay, so if you see the boundaries, just imagine this classroom. So this classroom is having roof, floor. Okay, it is having an anterior wall, posterior wall, then medial wall, lateral wall. In the similar way, the middle ear cavity is also having all the boundaries. Okay, it is also having roof, it is having floor, anterior wall, posterior wall, medial wall, lateral wall. Everything is present in the middle ear cavity. Okay, now those boundaries, they are having some important features. Multiple features are there in each and every boundary. Okay, so for that you have to know first how the boundary is formed. जैसे मान लो roof है, how the roof is formed. If floor is there, how the floor is formed. Okay, like this. And then what are the important features present in that particular boundary. This is the most important part of the middle ear cavity. I am talking about the gross aspect of the middle ear cavity. Okay, if you understand this particular part, you can easily write about the applied part also. You can easily understand about the applied part also. Okay, so I will request everyone to focus on this particular part, the boundaries. Okay, next, though it is a cavity, So something will be there inside the cavity, that means contents. Okay, so we have to classify the contents. For example, bones are there. Okay, if I ask you one question, general GK question, which is the smallest bone of our body? Okay, so that is inside the middle ear cavity. Okay, so that is inside the middle ear cavity. So like this, we have to study about the contents. Bones are there, blood vessels are there, nerves are there. Okay, then it is covered by mucous membrane. Though bones are present, skeletal muscles are attached to them. Along with that, some ligaments are present. Okay, so like this, different uh, components are there, or you can say contents are there inside the middle ear cavity. Okay. Okay, after contents, next will be the okay, so these are the points. First is the location where the middle ear cavity is located. Can you? I hope you can see the diagram of the middle ear cavity. Okay, you can see the middle ear cavity. So first we have to know the location of the middle ear cavity, then the shape and the dimensions of the middle ear cavity. Now, the shape of the middle ear cavity, we have to see the shape of the middle ear cavity in different sections. Okay, in different sections the shape is different. That will be explained. That also you have to follow. Next, communication. So here you can see it is communicating, it is communicating, it is communicating. Okay, so various communications are there. So you have to know the communications of the middle ear cavity. Means it is communicating with what? Mainly two important communications are there. Next is the subdivision. What is the time? Go to library. What is the subdivision? So the middle ear cavity is divided into three different parts. Middle ear cavity is divided into three different parts. That comes under the subdivision of the middle ear cavity. Okay. Next, boundaries. So as I said, if a cavity is there, we have to define the boundaries. Okay, so in boundaries, how to study? I have mentioned the points. First of all, you have to know how it is formed, and you have to know what are the important features of each and every boundary, which is the most important part of the gross anatomy of middle ear cavity. Okay, followed by the contents. So if a cavity is there, inside the cavity something will be there. Okay, so what are the contents? We have to classify them, we have to segregate them. As I have mentioned, bones are there, muscles are there, ligaments are there, nerves are there. Okay, like these different contents are there. We have to segregate them, and then we have to study. Okay. Lastly, as usual, blood supply, nerve supply, lymphatic drainage, and applied. Now, in case of middle ear cavity, please note that mostly questions are asked from the applied part, and questions are asked from the boundaries. These are two important aspects of the middle ear cavity. Okay, that means you can expect questions from these two particular areas. Okay, so we'll start. Now, everyone, you know that the ear is the organ of hearing. The ear, total, I am talking about. It is an organ of hearing. Along with that, it also maintains the equilibrium of our body. That means it maintains the balance of our body. And the ear is divided into three parts. What you see from external, that is the external ear. Okay, as you can see the diagram, this is the external ear, and it is continuing as external auditory meatus. Then we are getting the tympanic membrane. Okay, next to the tympanic membrane, this particular part is the middle ear cavity. Okay, so I am talking about this particular area. This is the tympanic cavity. Okay, or also called as middle ear cavity. So today we will be studying mostly about this particular area, tympanic cavity. Okay, and and another part is that is the internal air. So three different parts are there. Okay. So first we'll be discussing about the middle air cavity. Now, as I said, how we'll study the middle air cavity? So these are the points mentioned. Now, what is the other name of the middle air cavity? Tympanic cavity. ठीक है, तो अगर एग्जाम में क्वेश्चन आया कि राइट अबाउट द टिम्पेनिक कैविटी, डोंट गेट कंफ्यूज, सेम टिम्पेनिक कैविटी, मिडिल ईयर कैविटी, इट इज सेम. ओके, तो फर्स्ट यू हैव टू नो द लोकेशन ऑफ द middle ear cavity or tympanic cavity. Okay, so where it is placed? So it is a narrow air filled cavity. So mainly air is present, other structures are there, along with that air is also present inside the cavity. Okay, so it is a narrow, or you can say small air filled cavity. Where it is situated? It is situated in the petrous part of the temporal bone. Petrous part of the temporal bone. I hope you have seen the temporal bone. You have studied normal lateralis, right? So in normal lateralis you have seen the temporal bone. Have you seen the petrous part of the temporal bone? Seen? Okay, then it's fine. Then you will be having an idea where exactly the petrous part of the temporal bone is situated. Okay, next it contains the auditory ossicles. So inside the middle ear cavity or tympanic cavity, the auditory ossicles are present. Okay, which is one of the smallest bones of our body. Okay, next if you see the size and shape, this is very important to see. Middle ear, the shape is just like a cube which is compressed from side to side. So if you see the without taking any section as a whole, if you see the middle ear cavity, it is just like a cube, but the cube is compressed from both the side. Just imagine you have taken a cube in your hand and you have compressed, you are compressing the cube from both the side. What will be the appearance? So that is the shape of the middle ear cavity. Next, in coronal section, if you take the coronal section, what is the appearance? It is biconcave disc, just like red blood cell, if you take the coronal section. Next, if a long section is taken, okay, if a long section is taken along the long axis of the petromastoid bone, then the appearance is just like a pistol. I hope everyone you have seen pistol, right? See, this is the appearance. So if a long axis is going through the petromastoid bone, at that time the appearance is just like a pistol. Okay, exactly not like the pistol, but it resemble as pistol. Okay, तो ये देखो ऐसा appearance आएगा. Okay, now this is compared with the pistol, so that the shape can be understood easily. ठीक है. Now here, if you, I hope you know, this is the handle of the pistol. Okay, so which is formed by the mastoid process, and upper part of the handle is made up of mastoid antrum. Now this particular part is the cavity, the middle part, and the barrel is formed by the auditory tube. Okay, so this is how a long axis, when you are taking the section through a long axis in petromastoid bone, the appearance is like a pistol. Okay, so in the beginning I have mentioned in shape, the depending on the section the shape is different. Okay, first we have seen it is cube shaped, where it is compressed from side to side. Next, in the coronal section, what is the appearance? Coronal section में कैसे दिखाई देता है? It is biconcave, just like red blood cell. Okay, and if a section is taken through the long axis of the petromastoid bone, then what is the appearance? Pistol shaped. Okay, next is the dimension. Okay, so if a cavity is there, you must know the dimensions of the cavity. So how to measure the dimensions of the cavity? You have to measure the length, you have to measure the width, you have to measure the breadth, all those things you have to measure, right? Now here you can see the diagram. This is the diagram. So the vertical diameter is 15 millimeter. Can you see the vertical diameter? This is the vertical diameter. The vertical diameter is 15 millimeter. Okay. Next, if you see the anterior posterior diameter, this is also 15 millimeter. Okay. Next, if you see the transverse diameter, so transverse diameters are variable. It is not same. Anterior posterior diameter, and if you see the vertical diameter, it is same 15 millimeter, but the transverse diameters are not same. Why it is not same? Any idea why it is not same? Yes, because it is compressed from side to side. In the beginning I have told you, just imagine you have taken a cube in your hand, okay, and you have compressed it, soft cube you have compressed it, तो क्या होगा? जो transverse diameter है, it will be changed, okay. So here also you can see the transverse diameter has been changed. So at the roof transverse diameter is 6 millimeter, in the middle part it is only 2 millimeter, and at the floor it is 4 millimeter. So these are the transverse diameters of various part of the middle layer cavity. Okay, as I said, in middle layer cavity, in each and every part the transverse diameters are not same because it is compressed from side to side. Okay. After this, what is the next point? Next point is the communication. Okay, communication. Now I'll give you an example. Suppose when you entered the classroom, इस classroom का communication किसके साथ है? How the classroom is communicating? Through this door. Okay, you can enter the classroom, you can go out from the classroom through this door. Any other communication? Windows are there. Okay, though it is closed, but windows are there, right? So similarly, you will see that in the middle layer cavity, though doors, two doors are there. Okay, these are the major communication. And in the walls, in the boundaries, small windows are there. Just like the classroom, you have small windows. Same thing will be there in the middle layer cavity. So those are the communication. Now for example, some windows which are present in the different walls, different boundaries, they are closed, but they are functioning. Same like the windows which are present over here. They are functioning, but they are closed. Okay. So similarly, these are the communication. So in case of auditory tube, the major communications are present on the anterior aspect and on the posterior aspect. ठीक है, सामने और पीछे दो communications होता है. So as you can see, anteriorly with the nasopharynx. So at the starting of the class, I have asked you, do you remember the features of nasopharynx? That's why I have asked. Because ये जो middle ear cavity है, anteriorly it is communicating with the nasopharynx. Through which part? Auditory tube, or also called as pharyngotympanic tube. Very important. Okay. And in the applied aspect of the nasopharynx, I have mentioned that if there is any infection, it can spread into the middle ear cavity through this auditory tube. Okay, and that is called as otitis media. Next, posteriorly, it is communicating with the mastoid antrum and mastoid air cell. So, have you seen the mastoid bone in the skull? यहाँ पे you can feel it. This is the mastoid process. So mastoid process is a part of which bone? Mastoid process is a part of which bone? Temporal bone. Mastoid process is a part of temporal bone. ठीक है? तो on the upper part of the mastoid process, some air cells are present. Okay, those are called as mastoid air cells. So medullary cavity on the posterior aspect, it is communicating with the mastoid antrum and the mastoid air cells. Okay, so these are the two important communications of the middle layer cavity. Okay. Next, contents of the middle layer cavity. So if you see the contents inside the mucous membrane, what is present? Only air is present inside the mucous membrane. Okay, and outside the mucous membrane, various structures are present. Because mucous membrane will not cover all the structures, not possible. So just inside the mucous membrane, air is present, and outside the mucous membrane, different structures are present. Now, what are those structures? As you can see, air ossicles are present. So, how many air ossicles are there? 3 air ossicles are there. Okay. So, what are the names? Yes, Malleus, Incus, and Stapes. Which is the smallest one? Which is the smallest one? Stapes. Okay. So 3 air ossicles are there. Have you studied about this in osteo class? Is it done? Not yet. Okay. Next, 2 important muscles are there: tensor tympani and stapedius muscle. Very important muscles: tensor tympani and stapedius muscle. Next, the nerves. As you can see, so many nerves are there. Okay. So what are the important nerves present inside the middle ear cavity? First of all, as you can see, the chorda tympani nerve, which is a branch of facial nerve. then the main stem of the facial nerve passing through the facial canal, then tympanic branch of the glossopharyngeal nerve, caroticotympanic nerve, which is coming from the superior cervical sympathetic ganglion, and lastly the tympanic plexus. So inside the middle ear cavity, a nerve plexus is formed, okay, and that is called as tympanic plexus. Very important content of the middle ear cavity, okay, tympanic plexus, okay. So sometimes questions used to ask from that part also. जो 3 मार्क का क्वेश्चंस होता है, 3 marks question, from there it may be asked that how the tympanic plexus is formed and it is supplying which areas, okay. We'll discuss today about all those things. Next, blood vessels are there. So if soft tissue is there, that means blood vessels will be there, okay. So it is having rich blood supply, mainly the branches from maxillary arteries, branches from internal carotid artery, branches from middle meningeal artery, and few branches from external carotid artery are supplying the middle ear cavity, okay. That's why the middle ear cavity is having rich blood supply, and along with that venous drainage and lymphatic drainage, okay. Now, if bones are present, along with the bones, some ligaments are also present, which are attached to the ear ossicles. So these are the contents, okay. As we go to the boundaries, we'll be discussing about the contents also, okay, because this particular contents are present in some of the boundaries. कोई भी boundary में एक या दो contents रहता है, okay. So as we discuss the boundaries, the contents will also be discussed, okay. Next, subdivisions. So as I said, there are 3 subdivisions of the middle ear cavity. What is the meaning of this? Subdivisions का मतलब क्या है? Now suppose this is the classroom, okay. In the middle of the classroom, I have added a curtain and I have divided the class. तो ये क्या होगा? This will be the subdivision of this classroom. Similarly, जो middle ear cavity है, उसका 3 subdivisions है, okay. Now, how the subdivisions are done? No such curtain is there. This is for your understanding I am telling. Okay. So, middle ear cavity is divided into 3 parts. Okay. So, how it is divided into 3 parts? So, the tympanic mucosa, okay, is continuous with the auditory tube, mastoid antrum and mastoid air cells. Yeah. So, here you can see the subdivisions of the middle ear by the limits of the tympanic membrane. Now, if you have studied the tympanic membrane, you will come to know that the tympanic membrane, okay, on the lateral aspect, okay, what is the shape? It is convex, and this particular convex surface of the tympanic membrane is dividing the middle ear cavity into 3 parts. So, suppose this is the convex part, the part which is situated above the convex part situated adjacent to the convex part, and part situated below the convex part. Like this, 3 subdivisions are done. Let me show you the diagram. Yeah, here you can see. Can you see the tympanic membrane? So see the tympanic membrane towards the middle ear cavity. See, it is like this convex. Maximum convexity is called as UMBO. UMBO. Okay. Now this is dividing the middle ear cavity into 3 parts. So the part above the tympanic membrane, that is the epitympanum, just behind the middle ear tympanic membrane, that is called mesotympanum, and below it, that is called as hypotympanum. Okay, these are the 3 subdivisions of the middle ear cavity. Okay, and the subdivisions, in the subdivision, the ossicles are present. Okay, now in the hypotympanum, you will not see any part of the ossicle. जो hypotympanum होता है यहाँ पे देखो, ossicles are not present. So ossicles are present mainly on the upper 2 part. That means it is present in the epitympanum. So most of the part of the malleus and incus, they are present in the epitympanum. Okay. Some parts, lower parts are present in the mesotympanum, and entire stapes is present in the mesotympanum. Okay. But in the hypotympanum, these air ossicles are not present. Okay. So these are the subdivisions of middle ear cavity. 3 subdivisions. Okay. Next, in the middle ear cavity, okay, the middle ear cavity, as I have mentioned in the contents, that mucosal lining is there. Now, mucosal lining means lining epithelium is present. म्यूकोजल लाइनिंग में लाइनिंग इपिथेलियम रहेगा. ओके, तो 2 टाइप्स ऑफ लाइनिंग इपिथेलियम आर देयर. फर्स्ट ऑफ ऑल, mostly the mucous membrane is lined by ciliated columnar epithelium, except some areas where it is covered by non-ciliated and flat epithelium. Now, which are the areas where the ciliated columnar epithelium is absent? So these are the medial wall parts of the tympanic membrane, mastoid antrum and mastoid air cells. Okay, so these are the areas where ciliated columnar is absent. Instead of that, non-ciliated flat cells are present. Okay, next, goblet cells or mucus secreting cells or mucus glands are absent, but the areas adjacent to the opening of the auditory tube, in that you can see the mucus secreting goblet cells are abundant. Okay, so this is the feature of the mucosal lining of tympanic cavity. Okay, tympanic cavity का जो mucous lining है, this is the important feature. So 2 different types of epithelium can be seen. Okay, next, the most important and you can say the most difficult part, that is the boundaries. Okay, so what are the boundaries? Total 6 boundaries are there. Okay, so this is the roof, this is the floor, this is the anterior wall, this is posterior wall, this is medial wall, and this is lateral wall. Okay, these are the boundaries. Now, in each and every boundary, can you see some features? Right? So see, this is the roof, this is the floor. So in the roof you can see some important features are there. In the floor also you can see some features are there, some structures are present. Next, on the anterior wall also you can see some features are there, same in the posterior wall, and most of the features are present in the medial wall, and then on the lateral wall also. Okay, the best way to study and understand the and features of the tympanic cavity is to understand the diagram. Okay, and I hope this diagram is not that difficult. It's an easy diagram. Once you know the diagram, by looking at the diagram you can write the features, you can write the boundaries easily. Okay, so which is the roof over here? This one, this is the roof. Okay, now, so with the help of the diagram we'll try to understand the boundaries and the features. Okay, now another diagram is there which I have added. Yeah, here you can see this. This is a diagram where most of the features are shown. If you see this diagram, most of the features are shown. Now here, can you tell me which is the roof? This is the roof. Okay, this is the roof. This is the floor. This is the anterior wall. This is the posterior wall. Okay, and this is the medial wall. Lateral wall is removed from here. It is not shown. Okay, तो lateral wall कैसे रहता है? ऐसे रहता है, ऐसे रहेगा lateral wall. If the lateral wall is not removed, you can't see the medial wall. So here what they have done, they have removed the lateral wall so that you can see the medial wall. Okay. Now in most of the books I have seen, they have discussed and they have shown the lateral wall separately. Okay. Now in the previous diagram, see the location of the lateral wall. Okay, it is retracted so that you can see the lateral wall as well as the medial wall also. Okay, so with the help of the diagram we will try to understand the boundaries. So which boundary will come first? Roof. Okay, how to study the boundaries? How to study the boundaries? How it is formed and what are the important features present in the boundary. That's it, only these 2 points. And sometime what you have to mention is, not sometime, you have to mention that if this is the boundary, now this particular boundary is separating the medullary cavity from which part of the brain. Suppose this boundary is separating the classroom and the external part, right? Similarly, जो medullary cavities का boundaries है, it will also separate it from something that you have to mention. Okay, so first of all, the roof is formed by a thin plate of bone that is called as tegmen tympani. That is called as tegmen tympani. This one. Okay, this is called as tegmen tympani, which is a thin plate of bone, and it is a part of petrous part of the temporal bone. Okay, it is a part of petrous part of the temporal bone. Now, if you see the tegment tympani, now it is separating the middle ear cavity. जो tegment tympani होता है, as you can see over here, it is separating the middle ear cavity from the middle cranial fossa. So just above that, middle cranial fossa is there. Okay, and in the middle cranial fossa, you know, the brain is situated. Not entire brain, some part of the brain is situated in the middle cranial fossa. So that is separating the middle ear cavity. Okay. Next, the bony plate is pierced by two nerves. What are they? These are the greater and lesser petrosal nerve. As you can see, the bony plate is pierced by two nerves. Can you see? That is the greater and lesser petrosal nerve. Have you heard about these two nerves? Greater and lesser petrosal nerve? Anyone? Have you heard about the greater and lesser petrosal nerve? Greater petrosal nerve is a branch of facial nerve which is coming from the geniculate ganglion of the facial nerve. And what about the lesser petrosal nerve? It is a branch of tympanic plexus. ठीक है, ये देखो यहाँ पे tympanic plexus फॉर्म हो रहा है, tympanic plexus से निकल के जा रहा है. This is the lesser petrosal nerve. Okay, so these two nerves are piercing the roof. Okay. Next, so these are the features for roof. Next, if you see, there are some condition in which the tegment tympani is not ossified. Okay, tegment tympani remains unossified, and especially during child age. At that time, what happens? The infection from the middle ear cavity can reach the middle cranial fossa. Okay, so ये वाला जो part है, this part of the bone, suppose if it is unossified, then what will happen? The middle ear cavity is directly exposed to the middle cranial fossa. Okay, and the infection, if it is present in the middle ear cavity, it can go into the middle cranial fossa directly. So that is the roof. Okay. Next, after the roof, what is the next part? Roof के बाद क्या आता है? Floor. Okay. So see, this is the floor. See, this is the floor. Now, how the floor is formed? Floor is formed by the jugular fossa. Floor is formed by the jugular fossa, as you can see over here. Okay. Under surface of the petrous part of the temporal bone, and it is related to the superior bulb of the internal jugular vein. Okay. So it is formed by the jugular fossa. Okay. Under surface of the petrous part of the temporal bone, and it is related to the superior bulb of the internal jugular vein. As you can see, the superior bulb of the internal jugular vein. Okay. Next, in some cases the floor may be deficient. At that time, what happens? The tympanic cavity is supported by a mucous membrane and a fibrous tissue. Okay. So there may be some reason where the floor may be absent. The bony part of the floor may be absent. If it is absent, then a mucous membrane and a fibrous tissue is forming the floor. Okay. Now floor, the most important relation of the floor is superior bulb of the internal jugular vein. Internal jugular vein already we have discussed, and I have mentioned about the bulbs of the jugular vein. Okay. Next, what is the most important structure or most important feature of the floor? Can you see the floor? So this is the floor. Okay. Now the most important relation is the superior bulb of the internal jugular vein, which is present in the jugular fossa. Okay. Next, the most important content is the tympanic branch of the glossopharyngeal nerve. Okay. तो फ्लोर का जो anterior aspect है, from there you can see it is pierced by tympanic branch of the glossopharyngeal nerve. Okay. It is also called as Jacobson's nerve. Okay. Tympanic branch of the glossopharyngeal nerve. Like this, it is entering the middle ear cavity. Very important. And it is contributing in formation of the tympanic plexus. Okay, as you can see in the diagram. See, like this, it is going and contributing in the formation of the tympanic plexus. Okay. So I hope it is clear about the roof and the floor. See, roof, floor, anterior wall, posterior wall. It's very simple. The most difficult part is the medial wall. Okay, the most difficult is the medial wall. So till now what we have discussed this particular part. This is the roof, how it is formed and what are the structures piercing it. Next, this is the floor, how it is formed, what are the structures related to it, and we have seen the nerve, tympanic branch of the glossopharyngeal nerve which is piercing the floor. Okay. Next, on the anterior wall, so this is the anterior wall. Okay, this is the anterior wall. How the anterior wall is formed? So this is the carotid canal. In Norma Basilis, have you studied the carotid canal? I know you have studied the carotid canal. ठीक है? तो जो carotid canal का जो posterior wall होता है, that posterior wall is forming the anterior wall of the middle ear cavity. Okay, as you can see over here. Now inside the carotid canal, what is present? जो carotid canal होता है, canal means something is passing through it. क्या रहेगा? Internal carotid artery, as simple as that. You can see internal carotid artery is passing through the carotid canal. Okay. So if you see the anterior wall, it is bounded in the lower part by the posterior wall of the carotid canal, bony part of the carotid canal, and this bony part of the carotid canal is consisting of internal carotid artery and the plexus of nerve around the internal carotid artery, as you can see in the diagram. Sympathetic plexus around the internal carotid artery, that is also present over here. Okay. Next, from the internal carotid artery, okay, and the plexus, sympathetic plexus which is around the internal carotid artery, okay, carotico-tympanic vessels and nerve, they will pierce the anterior wall and then they will enter the cavity. Okay. So this is the internal carotid artery, this is the sympathetic plexus around the internal carotid artery. So from here the blood vessel and the nerve will pierce the anterior wall and then they will enter inside the middle ear cavity. Okay. So in most of the wall you will see something is piercing the wall and then entering the cavity. Okay. Next, if you go to the upper aspect of the anterior wall, जो anterior wall है, upper aspect of the anterior wall, can you see two canals? See, two canals are there on the upper aspect of the anterior wall. Okay. So the upper part of the anterior wall present two parallel bony canals. Upper canal is for tensor tympani muscle and lower canal is for bony part of the auditory tube. Okay, as you can see in the diagram. The upper canal is there, okay, which is extending backwards and going towards the medial wall. In that, what you are getting? You are getting the tensor tympani muscle. Okay, and next another canal is there. In this canal is for the auditory tube, bony part of the auditory tube. Okay. Now another important structure is there in between both the canal. Okay. So in between both the canal, a bony partition is there, okay, which is extending backwards along the medial wall, and that is called as processus cochleariformis. Okay, processus cochleariformis. As you can see in the diagram, so this is one canal, this is one canal. This is for tensor tympani, this is for auditory tube. In between both the canal, you can see a bony projection, okay, is going towards the medial wall. Now this is called as processus cochleariformis. Now this processus cochleariformis is forming pulley for the tendon of the tensor tympani muscle. You can see it is forming the pulley for the tensor tympani muscle. Okay. So these are some important features of the anterior wall. Okay. So anterior wall हो गया. So we have seen how the anterior wall is formed. And then what are the important features of the anterior wall. Next, anterior wall के बाद कौन सा आएगा? Posterior wall. Okay. Can anyone tell me which is the posterior wall? Yes. So if this is the anterior wall, which will be the posterior wall? This is the posterior wall. ठीक है? तो posterior wall इतना simple नहीं है. Some complexities are there in the posterior wall. ठीक है? So see, this entire part is the posterior wall, like this. This is the posterior wall. Okay. Now you have to understand that how the posterior wall is formed. Okay, what is there in the posterior wall? What are the important features of the posterior wall? The posterior wall is separating the tympanic cavity from the mastoid antrum. Okay, so in the beginning I have told you that in the upper part of the mastoid bone, okay, some air cells are present. So this posterior wall is separating the tympanic cavity from the mastoid antrum. This is the mastoid antrum. Okay, this is the mastoid antrum. So the posterior wall will be separating the medial cavity from the mastoid antrum. Okay. Next, important features are there. So first of all, the opening, a small opening is there on the upper part, okay, of the posterior wall, and that is called as epitympanum antrum. Okay. Now don't spell it as, don't pronounce it as Adidas. It is not Adidas. It is Adidas. Aditus. Adidas. Okay. Now student used to write Adidas. I have seen in the exam. That's why I am mentioning. It should be Aditus. TUS. Okay. So here you can see this is the Aditus to antrum. That means a opening. So this opening will communicate the middle ear cavity to the mastoid antrum. Okay. Next, fossa incutis is there. Okay. Now what is this fossa incutis? It is a small depression close to the lower part of the editus. So this editus to the antrum, close to this part, okay, there is a fossa. Okay, that is called as fossa incutis. Let me show you another diagram. So here you can see this is the fossa incutis. Okay, so this is the editus to antrum, and this is the fossa incutis, as you can see over here. Okay, so it is a small depression close to the lower part of the editus. Now here what happened, short process of the incus is suspended by a ligament. So this is the short process of the incus which is suspended by a ligament from fossa incutis. Okay, this is the feature of the posterior wall. Okay, next, in the lower part, so in the lower part you can see the facial canal is present. So this is the upper part of the posterior wall, this is the lower part of the posterior wall. Now in the lower part of the posterior wall you can see the facial canal is present. Okay, तो facial canal से क्या pass होगा, what will pass through the facial canal? Facial nerve will pass through the facial canal, as you can see. Okay, now this facial canal is opening into a foramen that is called a stylomastoid foramen, and from stylomastoid foramen the facial nerve is coming out and then it is supplying the facial muscles. Okay, the 5 terminal branches. Okay, so this facial canal will lead to the stylomastoid foramen. Okay, next, a hollow pyramidal eminence is there. Hollow pyramidal eminence which is projecting from the facial canal. Okay, now that contains the stapedius muscle. So here, wait. So here you can see this is the posterior wall. This is another diagram. So I am using different diagrams so that you will be seeing the different boundaries along with the different diagram. So this is the posterior wall. So in the posterior wall, upper part already we have discussed. In the upper part, editus antrum is there. Okay, then below that fossa incutis. Okay, so those are the features of the upper part. Now in the lower part you can see the facial canal is present. Okay, now from the facial canal, okay, a projection is coming out that is called as pyramid. Okay, a projection is coming out that is called pyramid or pyramidal eminence. तो उसमें क्या रहता है, stapedius muscle and nerve to stapedius. These are the two structure present in the pyramid or pyramidal eminence. Okay, canaliculus is there, that is called posterior canaliculus. From the facial canal, another canaliculus is coming out, that is called posterior canaliculus. Okay, and in that posterior canaliculus, what is present? Chorda tympani nerve is present. Chorda tympani nerve, it is a branch of facial nerve. Okay, so here you can see this is the posterior canaliculus. So this is the facial canal, like this it is coming, and here it will terminate as stylomastoid foramen. Okay, now here you can see this is the posterior canaliculus. Okay, from posterior canaliculus you can see this is the chorda tympani nerve which is coming out from the posterior canaliculus. Okay, so these are some important features of the posterior wall. Okay, next is the medial wall. So see, this is the medial wall. Okay, most of the features are present in the medial wall. Most of the features are present in the medial wall. So you have to understand the features one by one. So can anyone tell me which is the most prominent features in the medial wall? Can you identify the medial wall in the diagram? So this is the medial wall. This is the medial wall. Now you have to know the features of the medial wall. As I said, most of the features are present in the medial wall. Can you see the most important feature? This is the most important feature. What is it called? It is called as promontory. Okay, Promontory. Promontory. The most important feature in the medial wall is the promontory. ठीक है, तो क्या होता है ये promontory? Can you see it is a rounded prominence at the center and it is produced by the first turn of the cochlea. Okay, तो जो promontory होता है वो center में रहता है of the medial wall and it is formed by the first turn of the cochlea. Okay, next two windows are there. This is the oval window and this is the round window. Okay, or also called as fenestra vestibuli and fenestra cochlea. Two windows are there. Oval window. Why it is called oval window? Because it is oval shaped. Very simple. Why it is called round window? Round shaped. Okay. Now if you see the oval window, what is the location? It is situated above and behind the promontory. So this is the promontory. ये देखो, this is the promontory. So from promontory above and behind the promontory, we are getting the oval window. Below and behind the promontory, another window is there, that is called the round window. Okay. Now, in between both the window, okay, you can see a depression is there, that is called sinus tympani. In between both the window, okay, ये देखो, this is one window, this is another window. In between both the window, a depression is there, that is called the sinus tympani. ठीक है. Now these windows are very important, extremely important. Why? Through this medial wall, the medullary cavity is communicating with the inner ear. Okay, so whenever you are hearing any sound, okay, when the sound is falling into the external ear, then when it is going into the tympanic membrane, through tympanic membrane, the ossicles used to starts vibrating. Now that vibration, okay, is carried to the internal ear. How it is carried to the internal ear? Through these windows. Okay, that's why these windows are very important and the medial wall is also important. Like this, the sound waves are traveling into the inner ear. Then only the electrical impulses will be produced. Okay, now further is processed in the inner ear. Okay, so the oval window, if you see the oval window, it is reniform aperture or also called as kidney shaped aperture. Now it is closed by the base of the stapes and annular ligament. Now this is not open, it is closed by the base of the stapes and annular ligament. Okay, so the annular ligament and the base of the stapes will close the window. Okay, so what they will do, the vibration which is causing in the air ossicle, that is transmitted to the inner ear through this window. Okay. Next, if you see the round window, it is covered by a fibrous membrane and that is called as secondary tympanic membrane. Secondary tympanic membrane. Okay. So you have studied tympanic membrane, the normal tympanic membrane. Okay. Another membrane is there in the medial wall, that is called as secondary tympanic membrane. Okay. So the secondary tympanic membrane is a fibrous structure which is covering the round window. Okay. So this round window is covered by a fibrous membrane that is called as secondary tympanic membrane. Now this secondary tympanic membrane is separating the medullary cavity from scala tympani. Scala tympani is a fluid filled structure present in the inner ear. Okay, fluid filled structure present in the inner ear. Now I am not going into the structure of inner ear, both will mix up, you will get puzzled. Okay. Next, sinus tympani. So this depression, okay, in between both the windows, it is called as sinus tympani. Okay. So sinus tympani is a depression which indicates the position of ampulla of the posterior semicircular canal. That is also a part of inner ear. Okay. Next, in the medial wall, some other features are also there. Now, what are the features? Prominence of the oblique part of the facial canal, okay, on the upper aspect. So this is the medial wall. This is the medial wall. Now, on the upper aspect of the medial wall, here you can see the prominence, okay, of the facial canal. Prominence of the facial canal, that also the oblique part of the facial canal. Above that, you can see another prominence is there, that is prominence of the lateral semicircular canal. Okay? So these are some important features which are present in the medial wall. Okay. Next, after medial wall, which is the next one? Lateral wall. The only one wall left, that is the lateral wall. Okay. So ये देखो, this is the lateral wall. So if anyone asks you how the lateral wall is formed, now the lateral wall is separating the middle ear from the external ear. Okay, this external ear. So middle ear and the external wall, how they are separated? By the lateral wall. Now how the lateral wall is formed? It is formed by the mucus covered by the medial surface of the tympanic membrane. Okay, so most of the lateral wall, how it is formed? It is formed by the tympanic membrane, mucus covering the medial surface of the tympanic membrane. Okay, now if you see the medial surface of the tympanic membrane, as I have mentioned that it is convex in nature. Okay, ऐसे convex रहता है जो tympanic membrane है. The most convex part or the area or the point where most convexity is present, that is called as umbo, U-M-B-O. Okay, that is called as umbo. So that is also present in the lateral wall. Okay, along with that, in the umbo, handle of the malleus is attached. Okay, handle of the malleus, you can see handle of the malleus is attached to the umbo. Next, there are some features of the tympanic membrane which can be seen over here. Pars flaccida, pars tensa. Okay, these are some important features which can be seen in this particular wall. Okay, now what is the most important feature of this wall? That is the course of the which nerve? Chorda tympani nerve, as you can see in the diagram. Course of the chorda tympani nerve. Okay. Now, can anyone tell me how the chorda tympani nerve is passing? Two canaliculus are there. Two canaliculi are there. Okay. Anterior canaliculi and posterior canaliculi. So here you can see the course of the which nerve? Chorda tympani nerve. Chorda tympani nerve is a branch of facial nerve. Facial nerve. Okay. Now here you can see, so this particular part is the lateral wall. Okay. This particular part is the lateral wall. Now in the lateral wall, already I have told you how it is formed. It is formed by the medial convex surface of the tympanic membrane, and the most convex part is called as umbo, U-M-B-O. Okay. Along with that, you can see the handle of the malleus is also attached. Okay. Next, if you see, this is the course of the chorda tympani nerve. Okay. So chorda tympani nerve, two canaliculi are there for the chorda tympani nerve. Here you can see this is the posterior canaliculus. Here you can see the anterior canaliculus. Okay. Now the nerve enters the middle ear cavity through the posterior canaliculus. Okay. The course of the chorda tympani nerve is going through the middle ear cavity. Okay. So it is how it is entering the middle ear cavity? Through the posterior canaliculus. You can see. Now when it enters the posterior canaliculus, it passes through the lateral wall. Okay. Now you can see it is passing through the lateral wall, and then it comes out. Once it crosses the anterior canaliculus, there is a fissure called pterygotympanic fissure, and through the pterygotympanic fissure, this chorda tympani nerve comes out. Okay. Once the chorda tympani nerve comes out, where it will go? From pterygotympanic fissure, it comes out. Then where it will go? it will go to the infratemporal fossa, where it will be joined by lingual nerve. Okay, and lingual nerve already we have discussed earlier. So that is the course of the chorda tympani nerve. Okay, and that is the importance of lateral wall. Okay. So that is all about the walls, okay, and important features. So we have studied each and every boundary, and in each and every boundary, what are the features present, that we have discussed. Okay. So all those things are discussed. Next is the blood supply. So in blood supply, as I mentioned earlier, it is having rich blood supply. The miliary cavity जो होता है, it is having rich blood supply. Let me show you the diagram. Yeah, just see the. Can you identify the miliary cavity over here? Here boundaries are not mentioned. Can you identify the miliary cavity? See the diagram carefully. And anyone please tell me where is the miliary cavity? I know you can locate the miliary cavity. This one. Okay, this is the miliary cavity. Can you see the blood vessels which are going and supplying the miliary cavity? So mainly you can see branches from the maxillary artery. Okay, can you locate the maxillary artery? ये देखो, this is the maxillary artery. So branches from maxillary artery. Then you can see this is the middle meningeal artery, branches from middle meningeal artery supplying. Then from internal carotid artery, carotico-tympanic artery, and then some branches from the posterior auricular artery also going and supplying the medullary cavity. Okay. So branches, anterior tympanic branch of the maxillary artery. Okay. Then stylomastoid branch of the posterior auricular artery. Then petrosal branch of the middle meningeal artery, superior tympanic branch of the middle meningeal artery, tympanic branch of the internal carotid artery. These are the branches, arterial branches which are supplying the medullary cavity. Okay. Next, venous drainage. Now, venous drainage, though you have not studied the dural venous sinuses, so now just the name will be enough. Once we go into the brain, that time you will understand the dural venous sinuses. Okay, because here you can see pterygoid venous plexus is there, and along with that superior petrosal sinus is also draining the medullary cavity, and it is a dural venous sinus, superior petrosal sinus. Okay. And in lymphatic drainage, retropharyngeal, parotid, and upper deep cervical lymph nodes. Okay. Now, the most important and you can say the complex part is the nerve supply. Okay. Why it is complex? Any idea? Because the tympanic plexus is formed, and you have to understand how the tympanic plexus is formed. Now, till now, whatever we have discussed, have you noticed what are the nerves present through the inside the cavity? First is the facial nerve, you have seen. Then you have seen the chorda tympani nerve. Then you have seen the nerve to stapedius muscle. Okay. Then one nerve piercing the floor, entering, which is that is the Jacobson's nerve or tympanic branch of the glossopharyngeal nerve. Okay. So these are the nerves. Along with that, the anterior wall is pierced by carotico-tympanic nerves and vessels. They are entering the cavity. Okay, so like this, these are the list of nerves which are present. Now, directly you can't say that this nerve is supplying the medullary cavity. For that, you have to understand how the tympanic plexus is formed. Okay, so where the tympanic plexus is formed? On the promontory, which is at the center of the medial wall. Okay. So here you can see the tympanic plexus is formed by the tympanic branch of the glossopharyngeal nerve, also called as Jacobson's nerve, superior and inferior carotico-tympanic nerve. Okay, these are derived from the sympathetic plexus around the internal carotid artery. Okay. Next branch which is coming from the geniculate ganglion of the facial nerve. Okay, like this the tympanic plexus is formed. Okay. Now the tympanic plexus will supply the mucous membrane of the medullary cavity. Along with that, it also supplies the mastoid air cell and bony part of the eustachian tube. Okay, these are the parts supplied by the tympanic plexus. Okay. Next, from the tympanic plexus, one branch is coming out of the medullary cavity, that is called as lesser petrosal nerve. In the beginning, I have mentioned. ठीक है. Now this lesser petrosal nerve will contain the secretomotor fibers of the glossopharyngeal which supply the parotid gland via otic ganglion. In otic ganglion it will rely. Okay, that means it will be carrying the parasympathetic fibers. Okay. Now here is the diagram. So this is the tympanic plexus. ठीक है. So tympanic plexus, how it will be formed? As you can see, the tympanic branch of the glossopharyngeal nerve. ठीक है. Then this is the internal carotid artery. So the sympathetic plexus, the caroticotympanic nerve, which is coming from the sympathetic plexus around the internal carotid artery, they will contribute, and a branch will come from the geniculate ganglion of the facial nerve. Like this, they will form the tympanic plexus. Now, this tympanic plexus will supply the mucous membrane of the middle ear cavity. Along with that, it will also supply the mastoid air cell and the bony part of the auditory tube. Okay. One nerve is coming out of the middle ear cavity. Okay. That is the petrosal nerve. Okay. Now this lesser petrosal nerve, and now this lesser petrosal nerve, what it will do? It will supply the secretomotor fibers for the parotid gland via otic ganglion. Okay. So that is the nerve supply. So that is all about the gross anatomy of middle ear cavity or tympanic cavity. Okay. The next class will be discussing about the applied part. So as I mentioned here, this particular part, all those things are over, only the applied part is left. Okay. Applied part is also very important for the middle ear cavity. Okay. Okay. Thank you.